Hello everyone, welcome to the Heroes Initiative powered by IPCA. These heroes are instrumental in improving quality of life of the patients. Today we have one such hero who has improved life of tens and thousands of such patients. Doctor, we welcome you to the Heroes Initiative by IPCA. So doctor, now we are focusing on cataract surgery pre and post-operative care. So doctor, my first question for you is, what should I expect during the pre-operative assessment for cataract surgery? Are there any specific preparation do I need to make, doctor?
So cataract is, if I could add two lines to that. So cataract is nothing but the lens of your eye which has turned opaque. So just like when you age, your hair turns gray, the skin wrinkles appear. Similarly, in cataract, the lens which was originally transparent, that becomes opaque. So first up, cataract is not a disease, but it is a age-related process, right? So, which also means that all of us at some point in our lives will develop cataract. So there's no exception to that, right? So whenever cataract develops, the only way to get rid of it is by surgery. There are no medications, there are no exercises, nothing that can get rid of cataract. So this is the first point. So when you're going for surgery, initially the operating surgeon will do a thorough analysis of your eye, because the normal question that the patient asks is, all right, doctor, so I remove my cataract. So are you sure I'll be able to see 100%? Because obviously that is what the eye does, see. So the general question is that. That is why vision is contributed to by a number of other layers of the eye as well. There's the cornea, there's the retina, there's the optic nerve, there is the vitreous, there are lump. So before undergoing cataract surgery, the doctor will ensure that the other parts of the eye are functioning normally. Only then can the doctor and you be sure that after undergoing the surgery, you'll be able to see good. So that is the first test. So that includes tests of the cornea, tests of the vitreous, so that is the jelly inside the eye, tests of retina, tests of glaucoma or the nerve. So these tests are done. Apart from this, the doctor will also see whether or not you have an infection. So if in case you have an infection, the infection has to be treated prior to undergoing any surgery. And lastly, the doctor will have a discussion with you regarding the type of lens that has to be implanted. So the eye is like a telescope. So you remove the cataract, so that means the telescope has one of its lenses removed. So something has to be put in so that we can now see. So this lens, there are a variety of lenses. So the doctor will have a discussion whether you don't want to be dependent on glasses, whether you need yellow lenses, thin lenses, thick lenses, so on and so forth. And of course, lastly, you'll have to undergo a blood sugar test, because if the blood sugar level is beyond a permissible limit, in eye surgeries, we take the permissible limit to be 200. 200 is the PP, that is the blood sugar after food. So your blood sugar has to be below 200. This is the norm that we normally follow. And sometimes the doctors also order for an ECG test in case you have a heart condition or certain other comorbidities. So this, I think, you should expect before undergoing any surgery.
What are the most important post-operative care steps to ensure a smooth recovery after cataract surgery, doctor?
Right. So post-surgery, we have two aims. First is the wound that we inflict on the eye through which the surgery takes place. That wound has to be cured faster. And second, no infection should be allowed to enter the eye through that wound within a specific time. Usually the specific time allowed is about 7 to 10 days. So regarding the healing, we have certain medications which help in healing. Some lubricants are there, antibiotics, steroid drops, these are there. And regarding how to avoid infections, so you'll be given certain instructions like water should not be allowed to enter the eye. Then while going to outside places, dusty places should be avoided. Driving should be avoided. And sometimes in certain lenses, near power is not incorporated. So in those lenses, if they are implanted, you are asked not to see near objects like mobile phones, reading, etc. unless and until the power is given. So cataract surgery is basically a very complicated surgery, but with the advent of good instruments, good medicines, good surgeons, the surgery has been simplified. So sometimes it is said that अभी cataract surgery करना है 2 मिनट की बात है 5 मिनट की बात है. That does not in any way mean that the surgery itself is very simple or the procedure. That just means that we have such means of completing the surgery in 5 to 6 minutes. But the post-operative instructions have always, whatever they were previously, they are still now, and they have to.
Agreed, doctor, what you said. Are there any common complications after cataract surgery and how they can be managed or prevented?
Complications of cataract surgery, see, there are a lot of complications that can happen. However, because it is a surgery, so the body is being opened up from a particular point, so there are lots of complications. But the usual complications which happen are sometimes, the post-operative instructions are not communicated well, or the patient is unable to comprehend. So there might be certain infections. So if the infection is very mild on the surface, then it's fine. But a very dreaded complication is what is known as endophthalmitis, which means that the infection enters inside the eye. Now, this is a nightmare both for the surgeon as well as for the patient, because it is very difficult to treat, and sometimes the eye may be lost as well. However, fortunately, the incidence of endophthalmitis is very, very low. Like in, say, 10,000 people, 1 person might undergo endophthalmitis. First. Secondly, depending on how hard your cataract was, how mature it was, the recovery time may be prolonged. Like in immature cataracts, usually the recovery time means the time when you start to see normally. So in immature cataracts, it may be as less as 1 day, 24 hours. But in mature cataracts, it may take up to, say, 5 to 7 days to recover. Apart from that, you're not allowed to touch eyes, so lead to infection. Complication rates are very, very low. And whatever complications are there, they can be very easily treated.
So doctor, your expertise and insights on cataract surgery pre and post-operative care are invaluable to this initiative, and we believe your participation will greatly benefit the patients.